Hi guys, my name is Tammy and I'm a doctor of physical therapy, and in this video we are going to start talking about lower back pain. Now before you do anything else, please take a second to look at the indications, contraindications, red flags, and take a look at the disclaimer. So what I decided to do is that in this video I will introduce you guys to what repeated movement patterns are. This is the Mckenzie technique, and that tends to be very effective in relieving lower back pain. So in this video we are only going to go through what those movements are and how would you know if the movement's helping you or it's making your condition worse. Once you know what movement helps you, that will help us navigate for the rest of the therapy, for the rest of the treatments or exercises that will be helpful to you. So just bear with me as we go through these movements, try them out with me, and then once you know which one's better for you, I will have in the description below what other videos you need to look at to progress your exercises and hopefully feel better. This type of exercise therapy is beneficial for people who are having lower back pain, usually on one side, and they have pain traveling down their leg to their buttocks area, to the back of the hamstring, and even the ankle and toes. Okay? And again, our focus is on our functional impairments. We are not going to be focusing on why we are unable to do certain things or why our lower back pain is there. We are going to focus on what can we do to get rid of that condition, okay? All right, so we are all going to stand up. Our feet are going to be hip width apart, and the first movement is flexion. It's lumbar flexion. Again, you're not going with a flat back. We're not doing a deadlift. We actually want to bend our lumbar spine and try to go as far down as you can, pain-free, and try to come back up. Now, maybe when you reach all the way down, you might have some pain, or you might tell me as you're doing this, you're still experiencing your pain, but you realize after you're done your 10th rep that when you stand up and you walk a little bit, you're like, you know what? That pain that I was feeling in my calf or my ankle has moved up towards my knee, or even it has moved up towards my lower back. This is called centralization, which means your pain is moving from the distal part of your body up towards the center where where the origin of your problem is, right? You might even tell me, I have more back pain, but I feel nothing in my foot anymore. That's great. That's what we want, guys. But if you start doing this and after the fourth one, you're like, oh my God, I feel like my foot is throbbing with pain, or I have numbness that is increasing in my foot, that is bad. That means this exercise is probably horrible for you, okay? It's called this is called peripheralization, which means the symptoms are moving away from the center of the body towards the distal aspect of the body, okay? So let's try that together. If you don't have pain, if it's not making your symptoms worse, it's not traveling down towards your ankle, we're going to try to do this 10 times, okay? Now, after the 10th time, check in with your body, see how it feels. If this felt good, if it reduced your symptom, so now the pain went from your ankle to your hip, you fall into a category that responds better to flexion exercises. So again, look down in the description. I will guide you to what other videos you need to do. If flexion didn't feel good, you're like, Tammy, you know, my pain is the same, or if it made your condition worse, which is like every time I bend down, I feel shooting pain going down to my ankle, and now my ankles or my feet are numb and tingling, we are going to move to the second exercise, okay? Again, these are all repeated movements, right? What I want you to do is go into that same position. Have your feet hip width apart. Take your hands, put it in the small of your back, right? So I'm protecting my lower back, and we are going to go into extension of our lower back, right? It doesn't matter that you go all the way down, right? It's not a neck or a chest movement. It's just moving our lower back into extension, okay? So make sure your glutes are relaxed, okay? You don't want to, we're not trying to do a yoga pose where we're trying to protect our lower back with by squeezing our glutes. We are trying to see if this movement helps our condition, right? So we'll do this, and maybe you tell me, you know what, Tammy, the first 3, when I go back, I feel a pinching sensation in my lower back. Okay, that's okay. Move through it, see what happens, right? If you're feeling numbness, tingling, moving down towards your feet, your ankle, your toes, you stop the movement right away, okay? But let's say it's helping you and you finish the 10 and you're like, oh wow, you know what? My symptoms have reduced. Now I feel it in my back, but I feel no more in my leg. Great, you guys. You belong to the extension protocol. Again, link will be in the bio. Now let's say the first 2 didn't help you, okay? The next movement we are going to try are side glides, okay? So, you know, I'm pretty sure that you guys have always moved, you know, we go forward, we go backward, and we go sideways, right? So, or again, rotation. But here we are focusing on the glide. It's not a side bend. What you're doing is, go ahead, stand with your feet hip width apart. Take your hand, put it right on your hip, okay? Now from here, I want you to, it's like you're pushing with your hand, push your hips to the other side. I'm not bending, right? Upper body stays where it is. I'm just pushing my hip to one side and back to center. So as I do this myself, I feel like a stretching sensation in my lower back. But if you're having, again, if going this way after the 3rd, 4th one, it's increasing your radiating pain or tingling numbness in your foot, stop the exercise. If not, let's finish it off. Let's see how it feels if we do a little more. Okay, and let's say after our 10th one, you move around, you're like, okay, this was great. So again, link will be in the bio for if you responded better to side glides. But let's say going to this side didn't help. Now let's try the other side. Let's go to the other side. Now usually, if you respond better to this exercise, going to one way will really alleviate your pain and symptoms, and the opposite side will make it worse, okay? Which is pretty much common sense, I guess. And good. So after the 10th one, again, check in with your body. See where you are. You're like, oh, okay, you know, yeah, definitely feel better. Again, then you belong in the side glide category. And now from here, we are going to move down onto the mat. Either use a yoga mat or you can do this on a firm bed. So I don't want you to use your, like if you have a soft mattress, I don't want you using that. Try to be on some surface that is not super firm, but not really soft either. Okay guys, now that you are on your mattress, we are going to try a couple of other movements, okay? So let's say none of the other ones have been helpful, we are going to do these ones. So the first one is again lumbar flexion, but now we're doing it lying down, so it might feel different for you. So you're going to lie down. I want you to bring both of your knees to your chest, give yourself a little hug, and bring your knees down and back up, okay? So again, you're trying to do this about 10 times and see how that feels, okay? Great. So if this is helping you, it's centralizing your symptoms, again, you do belong in the flexion category, so definitely check out the video that I will put in the description for you guys. Now, if this was not helpful, the next movement we are going to do is going to be extension on the mat. So the way you start this off is if your body is in a lot of pain and you cannot do any of the extensions even in standing position, we are going to start off here. So first, you're just going to focus on lying on your belly, have your head down, and see how that feels. And then after a little while, again, make sure your bum is super relaxed. What I want you to do from here is to come up on your elbows, okay? And we're just gonna hold the position here. Make sure your glutes are super relaxed, your bum is relaxed, your belly's relaxed, and you are going to feel tension in your lower back when you do this, but it's almost like you're trying to move your lumbar spine, right? Now, you hold it for a few breaths, then you go back down, okay? Now, if this is helping you, we are going to move to the next progression of this, which is you put your hands on the floor and you prop your body up. Again, see how that feels? And you go back down. So again, we repeat this 10 times. Exhale, and you go back down, okay? So I'm just introducing these movements to you, so later on in the other videos, when we do stuff, I don't have to go into too much detail about them. But also, this is our screening tool, right? To see what our body responds better to. So let's say you do these and you're not, again, feeling that much relief from them. We are going to go through 2 other movements, okay? The first one, you're in the same position. All you're going to do for me is you're going to shift your hips to one side, okay? So right now, my body looks like a banana. So funny, I know. Anyway, so you bring your feet to one side, hips to the opposite side, and your body's in a curved position now. Now from there, try to, again, press up into an extension, okay? So this is different than the last one we did where our body was super straight, right? And then you see how that feels. Again, try to squeeze your shoulder blades away from your chest as you're doing this. Make sure your glutes are super relaxed. Great. And if this wasn't good for you, we can try it on the other side. So now we are going to bring our hips to the opposite side, and it's exactly opposite of what we just did, right? So now from there, push up and see how that feels on your symptoms, if it's centralizing it, and great. So let's say none of these worked for you, okay? So you get up after you do these exercises and you're like, Tammy, I feel no different. There's still one more movement we are going to try, and that is rotation movement. So what I want you to do is lie on your back with your feet on the floor, pick up your hips, drop it to one side of the room, okay? Then slowly bring your knees up, and we're going to drop our knees to the opposite side, okay? Then you go back to center. You can use your arms if you want for this. And again, drop to one side. See how that feels. If it's reducing your symptoms, you should be feeling a really nice stretch in your lower back. If it's sharpshooting, if it's causing referral pain, stop the movement. And if this wasn't helping you, we'll try on the other side. So again, go to center first, pick up your hips, drop it to the other side of the room, bring your knees to your chest, and drop them to the opposite side. And again, back up and drop them down. Even if you wanted to, you could kind of hold them a little bit longer, see if that makes a difference. And let's do one more time. Perfect, you guys. And then anytime you want to get up from these positions, I want you to turn to one side, use your arms to slowly come up, not your lower back, definitely not your neck. Okay, so this is a great introduction to figuring out how we can go about treating our lower back. Again, these repeated movements are the Mckenzie technique for treating the lower back. It is not meant for everybody. It's usually for people who have lower back pain with that referral pain going down to their leg. Can be due to stenosis, can be because of a disc issue, a facet joint dysfunction. It can be even degenerative disc diseases, right? So for whatever reason, there is tension on the nerves. And we try to do these movements to see how can we take that tension off that nerve, right? So if none of these worked for you, and you truly are someone who has a disc issue, again, I will put a bunch of exercises and movements such as home distraction techniques you can do to try to alleviate your issues. If you are not at all someone who suffers from radiating pain. And then again, there are different categories of exercises we can do to try to help you. Maybe you have a strength issue in your lower back, maybe it's a hip issue, maybe you have lack of a range of motion either in your thoracic spine or lumbar spine itself, or it could be an SI joint issue, right? So you can see it can be very complicated. That's why I'm trying to create this like soft, smooth way of taking you guys through exercises that will be beneficial for you. Again, please make sure to read in the description. I will try to explain all these things and try to guide you towards the correct exercises. And if you guys have any questions, feel free to contact us, leave a comment for me. And if you like the video, don't forget to like, share, and subscribe to our channel.